so much.
Thank you, Principal. You can have a seat. Thank you, Principal, Nursing Officer. One thing I would love to assure you, Salam means peace. People out there should know Salam means peace. Salam Charity is for all Ugandans. Someone might hear Salam Charity and they might think, these ones are Muslims and they're helping their fellow Muslims. I can give you a history. One time we passed here and were heading to Karamoja. We did some primary research before we came. Head of nurses here. This is the gentleman that actually headed the occasion for us to pass by and see what basic needs. Like you said, this is for starters. Like you said, you can find there's been a shortage of such wheelchairs. In the other word, actually, you've mentioned, we've been having shortages of beds or mattresses for our kids to be in. So this is the start. As time continues, we shall be in this region more and to make sure that we contribute the little or much that we have to make sure that we cater for our people. Here, people in Kampala, people who donate this don't only come from Kampala. They come from every area in Uganda. Once they tune on Salam TV like this, they just tune on Salam. Salam TV is on Star Times and Go TV. Star Times, it is just 293. That's the channel number for Star Times. And then you just change the same number on Go TV, 392. And then every evening from 9 to 10, these are the programs we have. Development, strictly. Salam TV is part of Next Media Services. I don't know if you heard about Next Media, which has NBS, Sanyuka TV, and that's where Salam belongs. But Salam TV, its major aim is development. And under Salam TV, that's where we have this organization called Salam Charity Foundation. Its role is to look for all where the demand is, the vulnerable communities, groups of people, where we can be able to do such kind of things. This is one of the gentlemen actually that contributed to the cry. So many people from Abubakari there, they have been crying so much when it comes to Soroti, that every time you come, why do you stop in Imbari? You don't cross this side. But we assure you, though we have ever passed here, we did something in Karamoja last year, I think. We did a massive medical camp there for over 5 days where we gave free treatment to different people. But we want to assure you, Salam is for everyone. Salam is for everyone, is for every Ugandan. As long as we know there is need somewhere, Salam will reach there. We thank our viewers who have really contributed much, small or whatsoever, way to make sure that this thing happens. So I want to thank you for recognizing that Muslims are not seen in this angle, but we are seen as people of a great heart that want to help and need to help our community in whatsoever way we can, without discrimination. That is very important. We work for humanity and we don't look at any discrimination. That is Salam. Salam is for every Ugandan. So from here, each nurse or doctor who would love to join Salam, we are very much open. You can join Salam. You can contribute as much and as little as you have. Even if it's 500 shillings, it can help and it can make a difference. God willing, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Kantu wala mkisaguno to invite our dear principal or the administrator for this hospital, who we found today has been working out. I wish I could have the time and stamina that I've seen our dear principal here that has been doing, and some little bit of dancing. If the music was still on, you would have seen our principal doing so many other things, activities. Sir, you're most welcome. Thank you.
Thank you very much. Salam alaikum. Yes. I appreciate everyone who is here. I want to start with the managing director, I think, for bringing your team over there, and the entire entourage from Salam Charity for visiting Soroti Regional Referral Hospital. By name, I'm called Moyabezi. I'm the principal hospital administrator, but standing in here for the hospital director, who is out of station. Yes, as my brother said, this is not how we dress in public service. but we have been allowed by the Commander-in-Chief to dress like this once in a week, because he has directed that all entities must ensure that they have what we call wellness club, where every single staff of government and any other person should participate in to make sure they're healthy. So for us at Soroti Regional Referral Hospital, we have a series of activity, among which we have 3 aerobic classes, one of which is Friday morning hours, which is 30 minutes, the rest are in the afternoon after 5. That is on Tuesdays and on Friday again, like today again in the afternoon, evening actually. So that is the reason I'm dressed like this for now, but during the course of the day we shall change and go to normal public service dress code. I want to thank you so much as Salam's charity for thinking about Soroti Regional Referral. This is one hospital which has been constructed in the late 1930s. And as you can see, the infrastructure is largely dilapidated, but we are making the best use of the structures anyway, because this is what we have for now. So thinking about us in this regard, as hospital management, we appreciate it so much. And as the principal nurse was saying shortly before me, we as government, sometimes we don't have everything. And that's the very reason why the private sector is very, very important for us under what we call public-private sector or public-private partnership, the 3 Ps. So whatever you have done to us is very, very important. Before I proceed, I need to let the viewers know what you have donated to us by quantity, item, and its quantity. What is before us here, we have 4 wheelchairs, which we can ably view them here. We also have 12 rolls of cotton wool. We have 12 mattresses. We also have, we have 10 mattresses and 3 boxes of surgical masks, and also 3 boxes of surgical gloves. We have 4 crutches, sets of crutches, and then 3 walkers, which we can view here. Then sanitizers, we have up to 11 liters. Then masks, there are 100 pieces. These are the donation which we have received from Salam Charity, and will go a long way to support activities in the hospital. And that's why we are earnestly appreciative of your contribution. As hospital and staff, we want to commit and pledge before you that these items will go to very good use. Why? Because we don't want a situation whereby if the administrator, God forbid, becomes sick, then it's given such a crutch, it goes with it. After healing, it doesn't return it to the hospital just because he's the administrator. We shall all use these items as patient in case any member of the staff is supposed to use them. Nothing like diversion, nothing like taking them home. We shall use and leave them in the hospital. We have been having serious issues with the wheelchairs and some of these orthopedic equipment. So as government, we have not been able to procure these items in quantities that are commensurate to the capacity of this hospital. So Soroti Hospital Regional Referral takes care of 10 districts and 1 city, which is us. There's a there are city facilities here. So we oversee all these facilities. So it is we receive patients from all these areas. So you can imagine that whatever we receive usually is not adequate, because we are the biggest referral facility in the region, and such contribution will go a long way to support and complement government initiatives. As Sister said also, there are quite a number of items or areas, special equipment, which we cannot meet these demands. Our budget from government is not as big as somebody else may think, that this is a regional referral hospital should get all this. But all what you people in the private sector are doing goes a very, very long way to support the interventions of hospitals to the catchment population. So we appreciate this so much. To the viewers of Salam TV, I want to thank you so much for this very wonderful contribution. But you know, you have also set the ball rolling for every citizen in this country. Because when I saw the truck coming, I said, what is this? It's a big truck. What has it brought to us? But you also, when you read that slogan there from Quran, Surah 2:43, I think that is what is up there. Yes, establish price and dispense jaka. Jaka, I think these are charity. Giving out, yes. At least that one I know. So this is a sign of humanity. Just sign of humanity, that you think outside the box. You think for the people. And this is where people should make very serious difference between Islam and fanaticism. Fanaticism, sometimes imagine these people are only Muslims, but they don't preach Islam. Because if we start thinking all Muslims can blow a bomb, then that is very bad for us as a country. So even the team, the family in the Islamic world, they should help us differentiate this category. Because we don't expect people who blow bombs to come and give charity like this. It's not possible. So that difference should be very clear. And I'm sure majority of Muslims don't accept that lives in meaningless manners like that. So together with these brothers and sisters, we are only doing it differently, but we are doing the same thing. Prayer to God, to Allah. We only do it differently. That is all. So we can't start, or we should not hate somebody by virtue of belonging to a particular denomination or a religion. Assuming you are in Qatar, I'm a Christian. Do I expect to be treated badly by Muslim brothers and sisters there? If they do so, and I feel bad, that is exactly how the Muslims feel when we treat them badly. You see? So for that reason, I think as a country we need a lot of unity, continuous intercourse between all the denominations, because we respect and worship one God. But also it is an appeal to all of us, and still an eye-opener for us to know that not only donation, not all donations should come from America, from Japan, from Korea, from Britain. We can do our donation as Ugandans. I'm very pleased to see that all these things are coming from our people. All the time you will find somewhere written, donation from blah blah, from the People's Republic of some country. Maybe one day we should start having something we also donate to other countries that probably are worse than us. There are countries that are worse than us. People even admire to be in Uganda. So what can we do to those other countries? So we need to take up this spirit of donation so that we are also seen not only to support ourselves only, but as well to support the rest of humanity in difficult situations. This should also be taken up, like when we always have bad situations in the country, the landslides. You'll find government is dying alone. Yet people can donate simple things, sufurias, can get some clothes, some used shoes. You take to our brothers in Bugishu or in Kasese. However, we also, maybe in the same thinking area, as hospital, we have a similar activity which we've agreed as management to take place twice in a year, where every single staff can donate any single item in monetary forms or in physical forms that we can finally give out to the patient. As we talk now, the welfare committee, and we have a church, we have a faith-based subcommittee of welfare committee that coordinates with the staff to bring in, every staff to bring in anything which they have at home, which they cannot necessarily use, to stock them in the hospital. Then we distribute them out to our patient and attendants. This activity has already started taking place, and we shall do it, implement it in December. All these last 3-4 months, we are picking everything. If there is money, they deposit, we register them. You have a pair of sandals, you have a pair of shoes, you have a shirt, you have a skirt, you have items which you can bring out and give out as charity. We have where we are keeping them. So we only need to probably move out to the community and also request them. There are so many destitute in this hospital. There are patients, if you go and see them, they don't have anybody who's even taking care of them, leave alone issues of these other items we think we can give them, even food. And yet, because of resource constraint and budgetary problems, government doesn't provide food to patients now. So administration is left with the burden of taking care of some of these needs. Somebody is totally destitute, probably could have been dropped in here, got in town, collapse. You don't know any relative, has no ID, it's brought to the health center. It's brought to the hospital here. We have to look for ways for feeding that person for a while. And some of this money is not there in the budget. Some of my staff, they pick their personal money from the pocket to feed some of these people. So all these are acts of charity, which I think we need to expand it to go to the community so that they can also support us. What we have done today is we have seen it for the first time, just as Sister said, to have it at this level. But we appreciate you so much. Even on behalf of the hospital director, I want to thank you so much for all what you have done. Salam TV, I saw it in one of the channels at home in Kampala. My children watch, because they understand Luganda very well. I didn't grow up there, but from 94, I was in Progressive SS. Belgerere, went to Makerere, did other 2 masters in central Uganda. I have a home in Kampala, but trust me, other than Imere, Jango Tulio Mere, and those things, I'm not good at our brother's language. But my children speak them, say it's okay. This is the way to go, because I always tell them and friends that if you don't eat at neighbor's place, you think your mother is the best cook. If you confine yourself with Itesot, with a Choli language, with the Logwara language, you think no other language exists, and you surely get problem. And I always also tell them, they are very good at not learning other languages of the region. I said, this Uganda is very fluid. Tomorrow you'll find yourself in Teso. You'll find yourself in Arua. You'll be in Bugishu. Bugishu, at least that is Bantu, you can forge. What about if you find yourself in Kapchora? You don't want to learn other people's language. So they should also try to learn other, because the business is everywhere, they'll find themselves there. So this is one way of bringing this country together and to appreciating other people's culture, which include language. So I want to thank you very much. This item, we shall take them on charge, and sister in charge will take over the principal nurse and also let them reach where they are. Yes, that's why I'm asking my friend here, do you have particular words where things should go? Of course, others are very obvious. We know where they should go. But I was looking at the mattresses. It's up to you. So you have really cleared us, because yes, every patient is important, but there are some special who are very special. Include children, maternity, gynae ward, maternity. Now we'll talk about it, the bigger sense. This is where life come out from. NICU, children who are not preterm born, they have not reached the date for coming out, but they want to come out. They're very small, sometimes as small as less than a kilogram. But we keep them here until they become big. So these are areas we have a lot of passion. And these donations, which have been blessed, should go to some of these units. We have other units like orthopedic, and then this bone thing, if I could put it in a way people understand quickly. Obviously, some of these things will go to them. These workers will go to them. Before closing, I need to request all our staff who are here to stand up for recognition. Minor sister, of course, so I don't want to disturb you. Yes, starting from behind there, sister, your name and where you work. Your name, title, where you work. Okay, yes. He's very happy, that's why I call him to be here. Yes. Yes, those are in the same department, largely with the first officer. Yes, thank you. I'm sorry now, because of when we are doing the administrative bit of this donation, some of the staff could not wait because we had been for aerobic and they had to rush back to the ward. So, kweli. So that's why we're trying to say, let's handle this. Even us now, we have not entered office since Asubui. We have to fall back. But I want to thank Abubakar. Thank you so much, our son and brother, for bringing this donation, turning the wheel of that big truck to first Teso. We are so happy. As I always say, if you have your own in the kitchen, you expect food to come out quickly. The food was going to come, but it could have not come very quickly. You see? So we appreciate so much. We thank all of us We thank the viewers. Please continue. Put Soroti at the heart. As management, we shall continue supporting every little efforts that are given to us. What we stand against in this hospital is corruption. These people must know. We stand against corruption. We are picking this hospital from somewhere which we don't want it to go back. We even pray, since we are rotational, we pray the team that will come after us should stand strong, because equipment is the reason why hospital exists. And when we pick equipment away ourselves, take them away, maybe to private practice points, or sell them, then we are doing disservice not only to this hospital but to the country. And the donors, you will be very, very lazy, if I could use that strong word, to lobby for support. Because each time you bring it, you come 6 months down the road, you'll find they are not there. So in this regard, we have to engrave these things before taking them to the ward. Sister, we have to engrave them. None of these items should go to the ward without being engraved. The mattresses sometimes is difficult to run away with, especially when they are already on the ward, because the ward is 24/7 with the people. But this other one can, some bad-hearted person can grow like, so we need them first engraved before they are taken to the ward from the store. And this is now our role. You know, you did a good job. We cannot again say you engraved. No, that is bad manners. So the engraving, we shall do it before we dispatch them to the ward. Otherwise, thank you so much, Salam TV, Salam Charity, and all the viewers. Let's continue supporting our colleagues. We are not the only vulnerable point. We have people who are vulnerable also in the prisons. I'm sure your eyes are also there. The people who are affected by natural calamities, you also support them. In our case, we thank you so much, and I appreciate your contributions. And on behalf of Soroti Regional Referral Hospital, we are indebted to you. The only way we should pay back is to use these resources well. That's when you will feel you feel satisfied indeed. And if you have your system on the ground, come back 6 months down the road, confirm whether these things are there, especially this one which we can show. Because sometimes donation of this nature come and we in court, or even either we steal in court or we actually steal them away, and you don't come back to confirm whether they are still around. You, as our son, our brother, you come around. Find out those workers we brought, are they still there, administrators? PNO, are they there? To give that trust. So that you also task me. You committed yourself that you'll keep this thing, that nobody will steal. You say you are fighting against corruption. Where are our crutches? So he'll put me also on my toes. Thank you very much, viewers, and I wish you the very best. We appreciate your contribution. Amen. Yes.
Thank you very much, Dr. Omoya. Abalabi baffe aba Salam TV oyo abadde omu ku bakulu abatwala eddwaliro lino erya Soroti Regional Referral Hospital, Dr. Omoya. Ekitusanyusizaamu nti nabo bakolayo omulimu gulinga ogwaffe ogwa charity. Basitaafu bonna yabagamba mu mwaka mulimu emirundi ebiri gye beekuŋŋaanyaamu akantu ne beekolamu omulimu, ne bakuŋŋaanya ku ngoye, abaleeta ku kasente ne bakaleeta, nabo ne bagabira abalwadde mu ddwaliro muno. Dr. Omoya, we thank you so much and for that initiative of that contribution from the staff. I think we shall also join you. We shall not leave you alone. So akaseera kano twagala GM akole omukolo ogw'okuhandinga over oba okukwasa ebintu bino eddwaliro, then tulabe ekiddako inshallah.
Our dear director, now it's the time to hand over the donations that have come from Salam Charity and the viewers of Salam Television that has contributed how much they have in small or bigger quantities to make sure that we can be able to buy such items that can be able to help this hospital. Where this will represent the rest of the wheelchairs. I hand over this wheelchair as one of the items that Salam Charity has donated to Soroti Regional Referral Hospital to help our patients. Yes. There's, then the General Secretary for Bilal also is handing over the wheel clutches, to the administration. Yes, we go. Then we have the surgical masks as some of also the donations we have for our hospital. We know cotton is very important, more special in every aspect, and it's the good thing the lady is handing over the cotton because it's more vital for the lady. And then we have sanitizer. We know that it is very vital in every aspect. So we have sanitizer. We have mattresses. We can get one mattress. We have walkers that also we bought that can be able to help. Mulaba fali ku Salam TV nga bwe tubadde tujja tukunyonyola olunaku olwaleero Salam Charity eri mu district ye Soroti era ng'omulimu ogwagireese okukola omulungi gwe gw'okulabika nga babaako kye baddiza eri amalwariro oba ne house facilities ezimu. Oyo mukadde waffe muganda waffe representative wa Salam Charity mu Soroti Obilanda Abubakari nga naye akwase omufaliso egimu gigenda okuba giyamba disposable masks esobola okuba nga ziyamba abasawo baffe abalungi okuba nga bakola omulimu ogw'ettendo in making sure they treat our patients this side in a very appropriate manner. Director, don't get tired of receiving. The hand that gives and the hand that receives never gets so byebyo ebintu ebimu Salam Charity byesobodde okuba nga handing over oba nga ewaayo ku ddwaliro lya Soroti Regional Referral Hospital. Gwe yakatweyunga ku Salam TV olunaku olwaleero nga bwe tugambye tugenda ttalaga amalwaliro ag'enjawulo mu kitundu kino oba mu disitulikiti y'Soroti okulabika nga tubakwatirako mu mbeera yonna gye tubasobodde era nga mu bintu ebimu ebiri mu ggaba olunaku olwaleero mwe muli emifaliso mwe muli obugaali emiggo cotton, gloves, sanitizers n'ebintu ebirala bingi nnyo ebigenda okuba nga biyambako amalwaliro gaffe. Kino kye mulabako kye kitono ekisobodde okuba nga kireetebwa naye nga mukadde waffe principal watugambye there is a lot that still be needed in this hospital to make sure that we put it at a level that everyone will be happy with. More especially the nurse has been so much passionate about certain categories of wards, more especially when it comes to the ladies and the children, which are very vital. And we pray that any viewer out there on Salam TV, if you see that there is more, like every time we do a call, that there is more need to make sure that we do in the health sectors in Uganda, please contribute in whatever way you can, physical, monetary, or in whatever way, so we can be able to make sure that our health facilities are well equipped. The government has done what it could, but even us Ugandans, we could do the same. Principal Kyogedde bulungi n'agamba it is now he is very happy that okulaba nga mu nsi yaffe tetukyajala bintu biva mu America bivaawa wabula bannayuganda ffe ffennyini ffe tusobodde okukwata mu nsawo zaffe n'ekitono tetulina so we can be able to do this. Gwali ku Salam TV sigalako ojja kusigala ng'okyalaba wetuva tukyatalaga amalwaliro ag'enjawulo era nga tukyali mu Soroto ennaku nga bbiri okuleka nga tukola omulimu guno omulungi ogw'okukwatirako baganda baffe mu mbeera eyo. Principal, thank you so much. This is what we could manage to be able to donate to Soroti Regional Referral Hospital. Doctors, thanks for the tremendous job you're doing of saving lives. It's a total commitment. Like us also in our side, we are very committed. No one is paid, but we do this out of a great heart and passion to make sure that we help all humans in our country, for good and our country. We love you so much. Thanks for doing the great job. Please, next time, welcome us. Even the Asukari should know. When he sees that big truck the principal was seeing, it just passes through because it's bringing so many quite good things for us. We're still in the region, and we assure you that if necessary be, we shall go back and mobilize for more. And our representative here, Mr. Bubakari, Obilan, will always come here and we also identify what more that we could come. If we have come with this, then the next time it will do another call for us to bring more things that are different from this, but as long as they aim to help our patients in Soroti. We love Soroti, We love the people of Soroti. We have been enjoying food ever since we came. Very nice. I wouldn't skip that. But thank you so much. I pray the next time we come back, the principal now knows so many words in Luganda except mere and sebo. Since he has stayed in the central part of Uganda so much, I pray by the time the sister has assured us it's only sebo and mere. So we expect when we come back, it is beyond that, and we could feel and hear a few words from Uganda from our dear principal. Mwabali Salam TV katuberekereze essaawa zino tujja kuba tuyengera mu malwaliro amalala era nga tukola omulimu gwegumu nga bwe tubagambye Salam Charity yazitabaala bitundu by'eno mu district y'e Soroti okulabika ng'ebaako kyeddiza mu health sector. Nga bwe mumanyi Salam Charity ebimu ku bigendera byayo bya bulamu mu byobulamu bye bino bwe tukola okulabika nga twekwipinga oba nga tuteekamu ku byuma bintu bye tusobodde ebisobola okuba nga biyambako mu malwaliro. Sigada ku lutimbo lw'emirembe lwa Salam Television. Mweraba wa Assalamu alaikum wa rahmatullahi wa barakatuh.